Alright guys, let's get busy talking about cannabis. This is going to become a lot more frequent on exams with the legalization of cannabis becoming more common across the country, and it's important to know how our patients present and how this drug works. So let's talk about the mechanism of action. It binds to CB1 and CB2 cannabinoid receptors, and this is how it's going to exert its effects throughout the body. Let's talk about how these patients are going to present, because I think it is important to differentiate this primarily from LSD. And this is because we have things like impaired judgment, euphoria, distorted perception of time, hallucinations, paranoia. You'll remember a lot of these are very similar to LSD. I like to think of the LSD symptoms as more significant in the hallucination, derealization, depersonalization category, and cannabis being a little bit more mild. Additionally, what can help you clinch cannabis intoxication is the accompanying somatic symptoms. So increased appetite. You may have heard of the munchies. So this is when patients are on cannabis, they get very, very hungry. So if you have a patient in the ER that is asking for like 4 turkey sandwiches, that's going to lead you a lot more towards cannabis intoxication versus LSD, which is not going to have that accompanying appetite increase. Additionally, patients will complain of dry mouth. This is oftentimes described as like a cotton mouth, as if you have a bunch of cotton balls in your mouth is so incredibly dry. This is another somatic complaint of cannabis users that helps separate it from other drugs. Now, we can also have conjunctival injection, which is a fancy word for really red eyes, as well as sleep disturbances. Some patients think that cannabis will help them sleep, but it can actually lead to insomnia as well, so that's something to be on the lookout for. Lastly, I want to talk about nausea and vomiting, and this is a pretty important one because we have a special syndrome called cannabinoid hyperemesis syndrome, and this is where a select portion of the population has extreme bouts of vomiting after trying cannabis. And this can actually happen at any use of cannabis. So a person could have used cannabis 3, 4, 5 times, and on their 6th time, they develop cannabinoid hyperemesis syndrome. And this is going to be unremitting vomiting after taking cannabis. And interestingly, one of the best ways to treat this is with capsaicin cream. So if you rub capsaicin cream on someone's stomach who is suffering from this, that like burning sensation from the capsaicin on a person's skin is really going to help them with their hyperemesis. Lastly, let's talk about withdrawal here. So withdrawal from cannabis is going to lead to things like anxiety, restlessness, and depression, as well as decreased appetite and insomnia. The withdrawal symptoms for me are not as high yield as the presentation symptoms. You really want to be focusing on the somatic symptoms here, like the conjunctival injection, the dry mouth, the munchies, the hyperemesis, in order to clinch a diagnosis of cannabis intoxication. And then it's also important to be able to relay this back to the fact that this is the CB1 and CB2 receptors that are being affected by this drug.